Good day, everyone! This is Charmaine Assistenza, and today's video, you will know and familiarize the different first aid measure to the selected emergency situation. But before that, do you know what is first aid? First aid is an emergency care or immediate care to a person or for a victim with sudden illness or injury. It is important to know the basic steps on how to give an immediate care when emergency situation arrives, since we can't predict when or where things will happen. So, fasten your seatbelt and let's begin with number 1. Scenario number 1. The victim is conscious. When someone is drowning, give the needed first aid urgently. The first aider must be capable of applying necessary and appropriate steps to attain the objective of first aiding. Check for vital functioning by monitoring the pulse and breathing of the victim. Place the victim in a comfortable position. Cover the victim with towel or clothes. Then, call the emergency services. Remember, check for vital functioning. Place the victim under comfortable position. Cover them with towels or cloth and call the emergency services. Scenario number 2. The victim is unconscious. When someone is drowning, the first aider or responder must remain calm so that he or she has a clear mind during the emergency situation. First, call an emergency services. Reassure the victim, conscious or not. If not, keep the victim lying down in order to immobilize the body. Check the vital functioning, the pulse, the breathing, if it is normal or not. Loose the tight clothes and check if there is something inside the mouth, ears, nose, or other open part of the body. If the victim is not breathing, perform CPR. Remember, reassure the victim, keep the victim laying down, monitor the level of response, and call the emergency services. When someone experiences shock, keep them calm. Help the victim to lay down. Then, raise their leg above the level of the heart to increase blood flow to head and vital organs. Loosen tight clothing. Then, call the emergency services. Reassure the victim and keep them calm. While waiting, keep the victim warm. Cover them with blanket or any available clothes. Monitor their level of response. Remember, lay them down, raise the legs, and loosen tight clothes. Monitor the level of response, and then call the emergency services. Someone experienced fracture and wounds in a motor vehicle accident. Treat them and keep them calm. Support the victim's affected area. Put a splint or any straight and hard object to support the arm. Use any cloth to tie the splint. Do not tie in the affected area. Tie in the area that is not affected. Create sling to avoid further injury. Call the emergency team. Check the victim if there is any injury or wound. If the open wound is bleeding, apply direct pressure. Let the victim stay calm. Remember, call the emergency services, immobilization, and locate any fracture or wound. Put a splint and apply direct pressure to the wound. Put a sling and monitor the level of response. Someone experienced burn. Move the victim away from the heat source. Do not use toothpaste or other ointment. When experiencing burn, place the affected area under cool running water for about 10 minutes. If it is a serious burn, seek medical advice. Remember, move away from the heat source. Place the affected area under running water. Do not use any ointment. If serious burn, Seek medical advice. When someone is bitten by a venomous snake, do not panic and keep the victim calm. Control the bleeding by applying direct pressure. Then, call an emergency services. While waiting, ensure the victim's position. The heart must be higher than the snake bite. Talk and reassure the victim. Let them stay calm. Remember, control the bleeding. Apply direct pressure. Call the emergency services. Reassure the victim. Keep the victim calm. When someone is bitten by a dog, place the affected area in a running water. Use antibacterial soap in a circular motion. Use clean cloth to dry the wet affected area. Use betadine in an outward circular motion. Remember to ensure the dog bite. Visit a clinic for treatment. Remember, place the affected area in a running water. Use antibacterial soap in a circular motion. Use cloth to let it dry and apply betadine. Next, visit a clinic for treatment. When someone suffers heat exhaustion, rest the victim in a cool location. Loosen or remove any tight clothes. Cool the victim by wetting them through water. Let the victim drink water but not too quickly. Monitor airways and breathing and treat shock. Remember, rest them in cool location. Loosen tight clothing. Cool the victim by wetting them with water. Slowly let them drink and monitor the level of response. When someone accidentally drinks poisonous liquid or substances, ask the victim what they swallow, how much they swallow, when is the time they swallow it. Monitor the level of response. Look for clues whether the body reacts to the poison. Call for an emergency services. Reassure the victim and monitor always their level of response. Remember, ask the victim what, how much, and when they swallow it. Look for clues, reaction to the poison in the body. Call the emergency services, reassure the victim, and monitor the level of response. When someone eaten a food that they are allergic with, they will suffer allergic reaction. The first thing you should do is to find a medicine. Allergic reaction gets serious, call the emergency services. Remember, let the victim drink anti-allergic medicine. Proper ventilation and monitor the level of response. Call the emergency services, reassure the victim, and treat the cause of shock. Here are the steps on how to treat and cure nose bleeding. Pinch the soot part of the nose of the victim. Let him or her sit down leaning forward. If necessary, call for an emergency services. Remember, pinch the soot part of the nose. Let the victim sit down leaning forward. Call the emergency services, reassure the victim, and treat the cause of shock. When someone suffers hyperventilation, take them somewhere quiet. Ask other people to turn away or leave. Encourage them to see a doctor. Remember, take the victim somewhere quiet. Ask other people to turn away or leave. Give them fresh air. Reassure and encourage the victim to see a doctor. If someone experiences choking, let them cough. If it is not effective, slap it out 5 times. If it is not effective, squeeze it out 5 times. Then keep repeating the steps. Remember, let the victim cough. If not effective, slap it out. If not effective, squeeze it out. Keep repeating the step. Call the emergency services. If someone experiences dizziness, the first thing you must do as a first aider or first responder, lay them down, raise their legs, give them fresh air, help them sit up slowly, and treat the cause of shock. If the victim is unresponsive, call an emergency services. While waiting, always monitor the level of response. Remember, lay down the victim. Raise both legs of the victim. Give them fresh air. If responsive, help them sit up. If not, call the emergency services. If someone experiences seizure, the first thing you must do is clear away the things around the victim. Protect the head. Check for the vital functioning. And call for an emergency services. Remember, clear away the things around the victim. Wait until the victim stops moving. Protect the victim's head. Check for vital functioning. If not responsive, call the emergency services.